The 3M VAC Therapy system is an integrated wound management system for use in acute, extended, and home care settings. When used on open wounds, it is intended to create an environment that promotes wound healing by secondary or tertiary intention by preparing the wound bed for closure, reducing edema, promoting granulation tissue formation and perfusion, and removing exudate and infectious material. VAC dressings come in multiple shapes and sizes to accommodate a wide variety of wound types, sizes, and shapes. The components of VAC dressing kits are the 3M VAC dressing, which includes the 3M VAC granufoam dressing, the 3M VAC white foam dressing, and the 3M VAC granufoam silver dressing, the SensorTrack pad, the 3M VAC drape or 3M VAC Dermatac drape, and a 3M VAC ruler with 2 foam quantity labels. All components are disposable, single-use only, and packaged sterile. Before applying a new dressing, remove and discard the previous dressing per institution protocol. Thoroughly inspect the wound to ensure all pieces of dressing components have been removed. Perform a thorough wound and para-wound area cleaning per physician order or institution protocol prior to each dressing application. Ensure adequate hemostasis has been achieved. Shown here is a wound in the sacral area requiring a standard VAC dressing using VAC drape. Assess the wound dimensions and pathology, including the presence of undermining or tunnels. Do not place foam dressing into blind or unexplored tunnels. Use VAC white foam dressing with explored tunnels. Cut the foam dressing to dimensions that will allow the foam to be placed gently into the wound without overlapping onto the skin. Gently place the foam into the wound cavity, ensuring contact with all wound surfaces. Do not force foam dressing into any area of the wound. Trim the VAC drape to cover the VAC dressing foam and an additional 3 to 5 cm border of intact para-wound tissue. The drape may be cut into multiple pieces for easier handling, retaining a portion of the blue handling tab on each piece. Partially pull back one side of layer 1 to expose the adhesive. Be sure to hold the layer 1 flap back to prevent readherence to the drape. Place the adhesive face down over the foam and apply drape to cover the foam and intact skin, ensuring it covers at least a 3 to 5 cm border of intact para-wound tissue. Remove green striped stabilization layer 2. Remove perforated blue handling tabs from drape. Now, choose the pad application site for the SensorTrack pad. Pinch the VAC drape and carefully cut an approximately 2.5 cm hole, not a slit, through the VAC drape. The hole should be large enough to allow for removal of fluid and exudate. You do not need to cut into the foam. Apply the pad, which has a central disc and a surrounding outer adhesive skirt. Remove both backing layers 1 and 2 to expose adhesive. Place the pad opening in the central disc directly over the hole in the drape. Apply gentle pressure on the central disc and outer skirt to ensure complete adhesion of the pad. Pull back on the blue tab to remove the pad stabilization layer. Connect SensorTrack pad tubing to canister tubing and ensure clamp on each tube is open. Position clamps away from the patient. Turn on power to the VAC therapy unit. Select prescribed therapy setting. Assess dressing to ensure seal integrity. The dressing should be collapsed and have a wrinkled appearance. There should be no hissing sounds. For more product demos and application techniques, Visit 3m.com/medical.